Good afternoon, everyone. It's so nice to be here. So I will share some of our insights from work that we have done using AI for strategic intelligence. So how can we use AI as a tool to develop high-quality insights that can then be used and kind of turned into strategies, well-informed strategies. So let's see if this green button here works. Indeed. All right. So I'll actually talk about two different cases. And spoiler alert, this does not involve asking ChatGPT for answers or insights. So two different cases. And the first one is based on work that we've done with Bayer Foundation, also in collaboration with World Economic Forum's Global Alliance for Social Entrepreneurship. And the objective here was to map barriers to inclusive health in the Global South, and also solutions. So what are social entrepreneurs doing to address these challenges? There were a few more aspects, but we'll simplify a little bit for the sake of this discussion. So, and I will focus on the methodological aspect here, so I won't go too deep into the results. But how would you go about this kind of study? If we kind of go to the basic unit of analysis here, and I'm really sorry, care to call you a unit of analysis. So when you're kind of in this analytics mindset, you see the world in a strange way, but that's kind of how we see it from an analytical perspective. So we have these different startups. This particular company is based in Nigeria. They are doing some really cool stuff. They provide microinsurance services in Nigeria, and you can pay with recyclable waste. So as they say, pay as you like, cash or trash. All right, so they are addressing two different challenges, two different issues. The lack of insurance coverage and also pollution. So if we want to learn more about them, that's pretty straightforward. We can give them a call, talk to them, learn more about the situation. Now, if we zoom out a little bit and we want to understand and map barriers and solutions in Nigeria as a whole, that becomes more complicated. But still, we can use traditional methodologies to do this. So we could run, focus groups, maybe expert interviews, maybe surveys with social entrepreneurs. So that's still kind of possible. But in this project, we had to zoom out even more. In fact, much, much more, because here we needed to cover 113 countries all across the Global South. And so how do we work with that giant scope on the level of detail that we needed for the strategy process here, and within a reasonable timeline, so not for years and years? And so this is where AI comes in and really saved us. So the way we used AI here was we used AI, text analytics, large language models to mine large volumes of information, news, reporting, international and local across these different countries, including a number of local languages, academic articles, social media, basically anywhere where we thought there might be some useful information. So we kind of asked the AI to read through all this information, pull out information about barriers and about solutions. And then we used other models to cluster this information. And this is a little bit like, I'm sure most of you in this room have been in these workshops where you're putting stickies on the wall. So I have my observation here, and you have your observation, and they are kind of similar, so we put them in the same place. And then clusters emerge from that process. The AI does exactly the same. It's just that the AI is working with millions of stickies, and it's doing the clustering in this high-dimensional semantic space. But at the end of that, we have different clusters representing different barriers and different solutions on different levels of granularity. So that brings us this bottom-up taxonomy of barriers and taxonomy of solutions, and then connections between them. And it also enables us to see then how these barriers and solutions vary across countries, how they grow over time, and so on. So this turned out to be very useful in order to pinpoint barriers that are addressable and solutions that are amplifiable. Of course, this is not a perfect methodology. Just like any methodology, this one has its shortcomings, which I'll be happy to discuss at length, although I don't have the time for that right now. And so it's really important to triangulate. In this project, we did validation workshops with various stakeholders across the different regions. There was another project partner that did in-depth expert interviews. But these different pieces came together in a really nice way. So I'll briefly also touch on a second example. So this one is work that we did with a foundation in the vision care space. The gap that they are tackling is the fact that almost 2/3 of people globally with vision problems do not have access to spectacles. And we heard, I believe, from Olivia in a previous session what a big impact it can make to actually provide glasses to these people. And their challenge was, this gap is not uniform across countries. The causes are different in different places, and therefore also the solution. So this also required a landscaping study. And here the scope was even bigger. It included 218 countries and regions. And I'll specifically focus on one aspect. Part of this was to map out activities. So we identified 13,000 unique activities in this space, and we were able to annotate that with, who was the funding organization, what was the beneficiary, different outcome metrics. But what was really interesting with this study was that it was really important to understand the policy aspects. So what are the policy gaps? And this had to be done along 28 policy dimensions. So access to insurance, awareness campaigns, and so on. And so that's the kind of information that is buried deep inside government documents. So it's not enough to mine, news articles. And the way that was then done was an approach that was not possible just 1 or 2 years ago, which is an agent-based approach. So we ask the AI, we don't give a protocol, step 1, 2, 3. Instead, we give an objective. Find this data point for country X, and then for country Y, and then for country Z, etc. And so and then we provided the tools as well for the AI, and especially to be able to search the internet for information. And then the AI was actually able to go out there and, first it made a simple internet search, couldn't find any information, then it tried to figure out what is the government agency involved in country X, then tried to figure out where are the publications from this agency, and eventually managed to actually find that information, that data. And so that worked out really well. All right, so my time is already up, but maybe one last thing I'll say, a bit more big picture, is that we're talking a lot about responsible AI. That's important. There are so many forces out there that are trying to use AI to, sow division and confusion and polarize. And there's a lot of, regulation work ongoing, which is very important. However, I think us here in this room should set the bar higher. So it's not just about responsible AI, it's actually to use AI to find all kinds of ways to use AI for the greater good. And that's also what we are trying to do. So thank you very much. And I have the honor, I believe, to present the next speaker, who is Gareth Bowen, CTO at Medic, where he leads the development of products designed to deliver tailored and targeted healthcare to the world's hardest to reach communities. With over 25 years of software development experience, including 15 years in healthcare, Gareth brings a wealth of expertise to his role at Medic.
Thank you, Thomas. Good afternoon, everyone. I'm Gareth from Medic. Just want to see if this works. So today I have the honour of talking to you about AI's role in human-centred community-based care. So briefly about Medic, if you don't know about us, we provide design, delivered and support world-class software for health workers as they deliver quality, timely, equitable care for everyone, everywhere. For over 10 years, Medic has advanced equitable care in solidarity with our partners, our organisations, governments and NGOs around the world. Our global team of innovators is 100 strong, spread across 19 countries. And as a founding member of the Community Health Impact Coalition, we envision the world where health workers are salaried, or, supplied, supervised, and skilled. We're currently have CHT deployments in 19 countries worldwide with 130,000 users and over 130 million caring activities since our inception. Our main tool suite is the CHT Core Framework. It works on smartphones, tablets, and computers. It runs offline first, so it can be used with as little or no internet connection. It supports local systems and organizational structures and internationalization, and integrates with digital health ecosystem. It's a highly configurable tool, which makes it easier to build scalable digital apps. Medic's approach to AI is much like our approach to developing the rest of our software. We believe in human-centered design and putting the health worker and the household at the center of everything we do. Our approach to AI is just the same. Innovations we do are in support of the health workers to lift them up and not replace them in the field. Our suite of tools include the health worker facing app, which helps them in their daily tasks, interoperability solutions to bring more data in to support health workers in their job, data warehousing to make it easier to query and analyze the data, and data quality tools to sanitize the data. When high quality data is made available to health workers and they're supplied with the tools to analyze it, they are truly empowered to make a big impact in their communities. In terms of national scale training, we have been chosen, the CHT has been chosen as the national tool for deployment in Kenya, Uganda, and Nepal. What this means is our partner ministries are getting access to large amounts of data for training models in AI, with AI. It also means that the models that get trained can easily be rolled out to hundreds of thousands of health workers quickly and easily. To ensure that these tools are sustainable for the long term, all of our tools are open source, global goods, community supported, and have zero license fees. When building our systems, it's essential to have local context and knowledge. So Medic's role is to supply our partners with the tools and the resources they need. By standing firmly with these principles of self-determination, we avoid data colonialism and empower communities to lead on the development of their own health systems. As an example of this, Medic has built extensibility into the CHT, so AI-generated models can be executed offline during the report creation process. Our partners in Zanzibar, D-Tree, used a machine learning model to predict clients' health outcomes, which was shown to health workers as a risk score. This score could be used to generate targeted interventions for clients that are at high risk of negative outcomes. By providing extensibility in this way, Medic empowers partners to innovate. It makes it easier to roll out a new tool progressively to existing health workers, which allows for rapid iteration, A/B testing, and ultimately scaling the tool out to benefit the entire community. One innovation Medic is designing currently is where the computer vision can be used to detect if a completed malaria rapid diagnostic test shows a positive, a negative, or an inconclusive result. We know that health workers with insufficient training can lead to participation errors, and when these tests are seen as inaccurate, they're often not used in the first place. This innovation is to investigate whether the use of AI combined with targeted training and precision nudges can increase the usage of MRTTs and the accuracy and the interpretation of the results. Medic believes that community health workers have been a global cornerstone of primary healthcare for a century, but are often not given the tools and the support they need to be as effective as they could be. Our vision is to supply health workers with smart tools to complement and support them to achieve their goals. With more data from the wider ecosystem, the CHT can make better suggestions to fully optimize their time. With smart route planning, The CHT can help health workers achieve universal health coverage with less travel time. With targeted training, health workers can improve their skills. With informed supervisors, coverage and training can be gaps in coverage and training can be found and resolved. And with supply chain prediction, the health worker can always access the medications and the test kits they need. Thank you for coming with us on this journey, and thank you for inviting me to speak today. Please reach out if you have any other partnership opportunities or would just like to discuss any of these initiatives. I now have the honour to introduce Cynthia McKinney is the Director of Corporate Relations at Project Echo, where she helps scale innovative solutions for global impact. With a decade of experience at Ashoka Innovators for the Public, Cynthia has supported social entrepreneurs and led strategic partnerships with major corporations to address diverse social challenges. Cynthia.
I want to thank Bear for this opportunity. It's really wonderful to be here. And as I was introduced, I am the Director of Corporate and Foundation Relations at Project Echo. And Project Echo was started in 2003 to really build the capacity to bring best practice healthcare to rural and underserved communities all over the world. Today, I'm going to, there we go. Today, I'm going to tell the story of how we've leveraged technology and over the last 2 decades, really our digital transformation at Project Echo, and really kind of our 3.0 version of how we're now looking at AI. So let's go back to 2003 and the inception of Echo. Dr. Aurora really wanted to build this capacity. He was the only gastroenterologist treating hepatitis C. He could treat about 150 patients in the state of New Mexico, and there are 28,000 cases. And if you do not treat, it's a disease that can be treated and cured, but if you don't treat it, it leads to liver cancer and death. And we see this scenario play out every day, people dying of diseases we know how to treat and cure. And back in 2003, the technology that was available was of low quality, unreliable, expensive, and bulky. And really at Echo, we still made it work. We were still building capacity and moving along really quite nicely. But what we saw was really when Echo really started to take off is when we partnered with Zoom. They gave us a global license because of our mission for free that we continue to this day to give out for free to all of our partners all over the world. In the 2010s, of course, we saw just a revolution in smartphone technology, and that further made it accessible to leverage the Echo model and to really get that access to the last mile. And during this time, the Echo movement would grow rapidly. From the first hub in New Mexico, today we have over 1,000 hubs around the world who have created a ripple effect for millions of participants, impacting underserved communities globally. But we wanted to think bigger. 1,000 partners, it's not going to really get access for the 6 billion people in the world that need it. So fast forward to 2019, we asked ourselves, how must Echo evolve to reach our goal of impacting 1 billion lives? That's a mission, well, it's actually an objective we have by 2025. So that summer, we went to Bangalore to work with some trusted advisors at an organization called Societal Thinking. And Societal Thinking is an initiative led by Nandan Nilekani, who is really credited with the digital transformation of the entire country. He's the founder of Emphasis, and he started Societal Thinking for the nonprofit sector to try and do the same thing for the nonprofit sector. They had built large-scale platforms, and we needed to learn from them. So we had 4 key objectives. We wanted to eliminate the barriers to participation in ECHO. We wanted to accelerate adoption of the model. We wanted to amplify impact of operations, and we wanted to empower and build community. So today, iEcho has over 100 features that support all aspects of running ECHO. It's used every single day. Over 400 of our partners have adopted it, and we're supporting the adoption by the rest of our partners. As we look forward to the future, and as technology continues to evolve, we continue to reimagine the power of iEcho, which is the name of our platform, for the ECHO movement. We realize that the secret sauce of ECHO is really our trusted human networks, where millions of frontline workers globally collaborate to drive impact. From the first ECHO network 20 years ago for hepatitis C, over 2 decades now later, thousands of networks in over 70 countries, in over 20 languages, addressing over 70 disease areas, ECHO has become a network of networks. Behind on that. So today, iEcho has many features such as search and discovery, public profiles, collaboratives, a discussion forum, and many more things. A mobile app, actually, as well. However, this is just the beginning. With recent advances in generative AI and cloud computing technology, we can harness the collective wisdom of this trusted human network and create a transformative impact for billions of people. I want to show you a short video. It's 3 minutes. I'm going to go a little over.
Introducing ECHO 2.0, an AI-enabled asynchronous enhancement of the ECHO model to transform learning outcomes at scale. Meet Dr. Shobha, a TB doctor based out of Andhra Pradesh, India. A patient with a complex case of TB visits her clinic, and she is unsure of how to treat him. A colleague refers her to Project ECHO. She downloads the iEcho app and signs up to join the movement. iEcho analyzes her information and prompts her to take a short quiz on TB to assess her knowledge level. Based on her professional background and knowledge level, iEcho suggests her to join the Introduction to TB Management ECHO program conducted by the National Institute of TB. Shobha takes part in weekly interactive ECHO sessions with national experts and learns about best practices in TB management. She presents the complex case of her patient to the panel and gets expert guidance. iEcho, powered with Apoorva AI technology, analyzes the case and finds a similar case from South Africa. Shobha uses iEcho to connect with the doctor from South Africa who presented that case and gets additional perspectives on her patient. She applies her learnings from the ECHO sessions and treats her patient successfully. In addition to the live learning sessions, Shobha uses the iEcho discussions forum to interact with her community to continue the learning asynchronously. She accesses asynchronous learning videos and reading materials at her convenience. She is prompted by iEcho to join the global TB ECHO community of over 50,000 TB professionals from around the world. She interacts with the global community, and her knowledge further improves with access to global best practices. Through the global community, Shobha comes to know of an advanced course on TB management to further enhance her knowledge. She completes this advanced course and receives a digital certificate from iEcho and a badge to certify her as an expert in TB management. As a verified expert, she now creates her own ECHO program in her native Telugu language to build capacity in the villages of Andhra Pradesh. Over time, Apoorva AI analyzes trends in patient cases being presented on the ECHO network and sees an uptick in a special type of drug-resistant TB cases being reported in a particular district. This information is highlighted to public health authorities to take action. This revolutionary innovation of the ECHO model will offer great benefits to learners, experts, and the community at large. Imagine a trusted human network of 20 million first-mile professionals like Dr. Schober, empowered with artificial intelligence to improve community outcomes and build a society resilient to future pandemics.
Thank you. I hope that gives you a little glimpse into the future